When it comes to our children's health care, we want to make sure their health is kept in mind every step of the way. Alexa spoke to a doctor about a new technique that could help.
The most common fast heartbeat in children is SVT, or supraventricular tachycardia. SVT is often fixable by a heart catheterization procedure, and today children needing this procedure can often have it performed more safely using a technique without radiation that is being done at Akron Children's Hospital. A recent study shows that this treatment should be the standard for treating children with this condition around the world. So here today to talk with us is pediatric cardiologist Dr. John Clark, director of the Pediatric Arrhythmia Center at Akron Children's, who pioneered this treatment. Doctor, we are so grateful to speak with you today. Welcome.
Thank you, Alexa. Thanks for having me.
Yeah, so Dr. Clark, can you tell us a little bit more about fast heartbeats in children?
Yeah, fast heartbeats are the common one, as you mentioned. SVT happens about 1 out of 300 times in children. Half of them are born with it, the other half grow into it later. Heart rates are pretty impressive. They can be around 300 beats a minute in newborns and about 200 to 250 beats a minute in teenagers.
Okay, well, now what treatments are available for kids with SVT?
There are two treatment options for those that need treated: medications or catheter ablation. Medications help keep the rhythm quiet, but they don't fix it. If the child needs a cure, then catheter ablation is the treatment of choice. Now, how catheter ablation works is the child is asleep and we put IVs in through the leg vein and thread wires called catheters up to the inside of the heart. And we can find the area of the heart that's causing it to beat too fast, and we cauterize it to destroy those cells that are causing the arrhythmia. Once the catheter goes into the body, we need some tool to be able to see it. And traditionally, this has been X-ray. In 2005, we started a new protocol utilizing three-dimensional mapping and ultrasound as a replacement for X-ray. Three-dimensional mapping uses 6 patches on the patient's torso that collect electrical information from the catheter and can triangulate the catheter in spaces, sort of like using GPS in the body. And the biggest benefit of that is it lets us eliminate radiation exposure.
I mean, doctor, as you're talking about this procedure, it's just amazing, and to think that you are leading the way with this, and it's right here at Akron Children's. So, talk about eliminating radiation, as you mentioned. Eliminating that exposure really is important.
It is. Radiation has many benefits in medicine, including diagnostic and sometimes therapeutic, but radiation also carries a risk, and the biggest risk is cancer. That risk is dose dependent. And so the larger your dose, the greater the risk, but there is no known lower dose. Any radiation exposure at all carries a risk. It's also cumulative in lifetime. So a bunch of little doses over time is the same as one big dose. And the longer you have to live, the more likely you are to express that cancer. So children are at the greatest risk because they have the longest to live. The government in 2009 published a report that compared our radiation exposures from the early 1980s to the mid 2000s. And over a roughly 25-year time frame, what they found was that for medical radiation exposure in the United States, there was a more than 600% increase on average for everyone in the United States. So medical radiation exposure had become its own epidemic. Because of that, many initiatives were born. Initiatives like Step Lightly and Image Gently that try to reverse that trend in the US. For our own part in the cath lab, we began a process that has led to the protocols we have today that have eliminated radiation exposure.
And doctor, we know that recently these advances have got some attention in the medical community. So, what do you see as the future for this procedure?
When we started doing this, we recruited other hospitals to do the same. And then we opened a database to keep track of outcomes for multiple institutions. And once we had enough data, we put that together and we compared the data to the standard of care that was using X-ray. And what we found was procedures that utilized three-dimensional mapping had significantly shorter procedure times, equal success rates, fewer complications, and a 97% decrease in radiation exposure. Not only that, 77% of the procedures required zero radiation. And while we think that's great, that still means 23% required some radiation exposure. In Akron, We've been at zero radiation for many years, and whether or not your child gets irradiated for a procedure shouldn't be dependent solely on whether or not you happen to live in Ohio. So we are going to continue to teach this and encourage this around the country until all hospitals that care for children with heart rhythms can achieve that zero radiation benchmark.
Doctor, you are phenomenal. Congratulations to you, and thank you for all of the work that you're doing. And for everybody at home, if you would like to speak with them directly, you can call 330-543-1000 or find them online by simply going to akronchildrens.org. Doctor, thank you so much.
Thank you, Alexa, for having me.
This segment of It's About You was sponsored by Akron Children's Hospital.